Hi everybody, I hope you're getting ready to have a great 4th of July weekend and week just around the corner. Actually, I also spent time in Washington this week meeting with the first robotics team of both Eden Prairie and Edina. It was great to hear these students talk about how their STEM education skills they've learned in the classroom, how they can apply that to their robotic skills, as well as learning business and marketing as a part of their competitions. Now let's get to our questions. The first actually comes in from John in Minnetrista. He sent in an email. Congressman Paulson, I want to encourage you to become a co-sponsor of the Furthering Access to Stroke Telemedicine Act, known as the FAST Act. It's critical to making sure that victims of stroke have access to the best care possible no matter where they live. This innovative technology allows patients to recover quicker and helps drive down medical costs by reducing long-term hospital stays. Please support this important piece of legislation. Thanks, John. John, as you know, it's critical that anyone who suffers a stroke as a patient receives care as soon as possible and is treated as soon as possible to avoid further damage to the brain. And unfortunately, about a third of Americans live more than 1 hour away from a primary stroke center, which often causes delay in getting the type of care that people need, as they may have to bypass a normal hospital as a part of getting treatment. The good news is this use of this telestroke program can dramatically increase a patient's access to having the appropriate care possible by allowing a neurologist to diagnose and then to treat through video conferencing technology and treat that patient, which is so critical using medical innovation to help keep healthcare costs down and treat the patient. I'm actually co-sponsoring the FAST Act, which will allow the expansion of the very successful telestroke medicine program within Medicare to any medical facility that is interested in using it. Next up is an email that comes in from Jan in Orono, and Jan writes in, Representative Paulson, the issue of substance abuse and treatment has been at the forefront of a lot of people's minds. Even our own communities in Minnesota have been hit hard by the recent opioid crisis. Making sure that those struggling with addiction have access to treatment is so important for them to get back on their feet. This is especially true for families, who are often hit the hardest when a family member struggles with addiction. Supporting policies that will allow families to fight substance abuse together can make all the difference. Sincerely, Jan. Actually, as Jan rightly points out, communities across the country have been negatively impacted by the opioid crisis, including right here in Minnesota. And while treatment options are available for many, it's often true that there are adults that have children that don't seek the appropriate types of treatment and access facilities that they normally would be able to for the fear of being disconnected with their children or separated from their children. Last week we passed a very important piece of legislation in the House that will guarantee that a child is able to stay with a parent while they are seeking treatment from a licensed residential family-based treatment facility. These are facilities that incorporate trauma education, parenting skills training, as well as family counseling as a part of its substance abuse program. Evidence has shown that these programs are highly effective in reducing substance abuse, relapses, but they remain very underutilized. And the bill removes the barriers to making sure that these programs can go forward and are more accessible. I want to thank everyone for taking the time to join this week. Continue to reach out anytime on Facebook, on Twitter, on Instagram, or of course at the website paulson.house.gov.